So the current picture when it comes to young people experiencing mental health problems, as many as 1 in 10 young people have a diagnosable mental health problem. We know that at the moment only about 1 in 4 children and young people who could benefit from treatment and support actually get access to NHS treatment and support. And by 2021, when the current NHS plan for improving young people's mental health is finished, it'll only be 1 in 3 that will be getting access. So still a long way to go, a really big treatment gap. What we know, and one of the things that really drives the Commission in its recommendations, is that half of lifelong mental health problems have their first signs by the age of 15. 3/4 of lifelong mental health problems have emerged by the age of 25. So the question the Commission has asked quite simply is, what if we did something a bit earlier, before those problems began to become mental health problems, tackling the causes that drove those conditions in the first place? And we know from the evidence that we've gathered that there is a lot that we could be doing to really upscale prevention in this country, tackling causes, not just mopping up the consequences. So what the Commission is calling for when it comes to the government and indeed other agencies as well, our call to action is that yes, we should start by scaling up what we already know works when it comes to prevention. Public Health England have published all the evidence that we need to start investing, but we just need to take a slightly longer term view about the payback, because the payback for children and young people, for our society, for our economy is huge. But we also need the government to be putting money into a discovery effort, a research and development effort that builds on what we know could make a difference, but where we don't necessarily have the full research yet about the interventions that will make the biggest difference. And we think that could be done by a grand challenge of investing in a resilient generation. Government's already doing this with its industrial strategy for healthy ageing, for mobility, for artificial intelligence. Surely the world's largest global health challenge, mental health, should warrant a grand challenge too.